the money will go to for TARC?
All of the money that we raise, 90 cents of every dollar that is donated to TARC, no matter if it's through Winter Wonderland or golf tournament or just, straight up donations, goes back to the programs for the people that we serve. So children birth to 3 who have a developmental delay or disability, we serve them at no cost and no waiting list. We are mandated by law to serve them. So last year we served over 850 children in Shawnee County, Topeka and Shawnee County, and that was in 2020. So those programs get helped with that amount of money, and then as well as our day service program, which is for adults who have a developmental disability, and they come to TARC and spend their day with us. They volunteer in the community. They have they have an art program. They do Bible study. They have karaoke. They play bingo. They go out into the community and do things. So those programs as well are supported by the money, and it's a very it helps fill the gaps where we don't have enough income to perpetuate some of those programs. The money from Winter Wonderland helps fill those gaps, so that's where our money goes.
It's very great.
So, any other questions?
Mays, anything? Or?
Oh, I think it's fantastic. I think, there was so much uncertainty in 2020 that I don't think anybody knew if it would be successful or not. It's great to hear that it was a record year. That's so great. So.
Yeah. Commissioner Rippon,
Great event. And but I'd like to thank TARC for everything that you do. The service you provide for the community is just fantastic. I also want to give another kudos to the Park Department, Parks and Rec, for all the work they do. And I know their staff puts in a lot of hours getting everything set up and tear down and crowd control and traffic control and everything that goes with it. So thank you guys for all your work that you do.
They are awesome. They're just so easy to work with. They're fabulous.
Thank you.
Thank you, Sherry.
Thank you very much.
All right. Our next item.
Item 3, consent agenda.
There are 4 items on the consent agenda. Are there any questions or is there a motion?
Motion to approve.
Second.
Motion to approve by Commissioner Rippon, second by Commissioner Mays. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item 4, new business. A, County Clerk. Number 1, consider all voucher payments.
Commissioners, voucher payments today total $1,918,131.87. Highlight of that, one item of note is under building and maintenance, Meridian Roofing Solutions for $23,736. That's for the roof replacement at Blaisdell Pool. I don't have any questions about the voucher report, and I would move for its approval.
Second. Motion made by Commissioner Mays, second by Commissioner Cook. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Number 2, consider correction orders.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Rippon. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item B, Parks and Recreation. Number 1, consider authorization and execution of contract C-101-2021 with Media USA, a 12-month agreement to have promotional electronic ads on local hotel kiosks at Capitol Plaza, Ramada, Holiday Inn, and the Stormontville Event Center at a cost of $1,200 with funding from the departmental operating budget.
Good morning, Commissioners. Tim Laurent, Director, Parks and Recreation Department. We think that this is a great way to let visitors to our community know what Parks and Recreation has to offer. So our aquatic centers, our golf courses, our historical sites like Old Prairie Town and Great Overland Station. And we see annually more than 70,000 views of that information on these kiosks. So we think it's a good investment, and we'd like to enter into the agreement. With that, I would be happy to answer any questions.
Any questions for Tim?
How do they get the word out? Is it, you say kiosk, is this an electronic thing, or is it just a thing with racks for cards? Or
No, I think the way I understand it is that's an electronic kiosk. So they'll go down there and be able to look through not just our information, but other things to do in Topeka. And what I understand is that we're either first or tied for first with the most number of views on those kiosks. So I think we do get a good bang for our buck, so to speak.
Okay.
Any other questions?
Yeah, Tim, so I see this is only for certain places
Yeah.
that this is available. Is there another vendor that we go through for other places?
There isn't, and as far as I know, this is the only one that we have, or that's doing this. I did have a discussion with Mike McLaughlin, and he told me they're actively trying to get into more hotels, and if they do that, then we'll probably be back up here trying to maybe revise the contract. But right now, they seem to be the only game in town. So.
Okay,
Okay.
good.
Is there a motion?
I'll move to approve.
I'll second that.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflected, it passes 3-0. Thank you, Tim. Our next item.
Item C, Health Department, number 1, consider approval of request to apply for the Kansas Department of Health and Environment Aid to Local Grants for the state fiscal year 2022.
Good morning, Commissioners. Teresa Fisher, Interim Director with the Health Department. Today, I brought a request to apply for the annual Aid to Local Grant applications through Kansas Department of Health and Environment. It is a large contract. There's 8 different grants that we're applying for through various programs, and so today I'd like to share some information about each of those programs with you. This year, our total grant request is $1,139,840. It is a little bit more than what we requested last year, and definitely more than what we received. And I would say just cost increase each year, and so that's why we have an increase in our request this year. Our first application is for our child care licensing. This is our regulatory program, so these are our child care surveyors that are out. They do the initial inspections, they do the annual inspections, they handle complaints. This would be for any licensed child cares, whether it's centers or home daycares. They do our summer camps, drop-in centers, anything of that nature. So this year we have about 335 licensed providers. This time last year, when I looked, we had about 349, so we have lost a few this year. This is something that we've talked about for the past few years that continues to be a need in our community is child care, so that's something we'll continue to work on. This program has actually been on hold during COVID for the most part of last year, but starting this month, KDHE has allowed us to go back in, so they're starting all of these surveys back up. Our request this year is $212,424. With this particular program and most of the others, it does go towards salaries for the staff. We then have our chronic disease risk reduction, also known as our CDRR grant. This really looks at chronic disease and how we can reduce the risk, really looking at improving the health of our community through this program. So some of the areas that we look at are tobacco use, physical activity, and nutrition. One of the past activities that we've worked on through this grant is the smoke-free housing that we've done in the past. So as a reminder to all of us, chronic disease results for about 90% of our healthcare costs. So it's something that remains vitally important for us to look at as a community. And this year, our request for this program is $72,850. We have our immunization action plan. So this is an actual allocated amount. So the amount that we are set to receive this year is $33,438. The state uses a formula to determine this allocation. And through this, we are able to provide vaccines for children that receive Medicaid through the state health insurance program at no cost to them. So our numbers for last year were obviously down due to COVID. Compared to 2019, in 2019 we did just over 6,200 doses and served over 2,100 kiddos. So our immunization department was closed for a portion of last year due to COVID, but it is open again by appointment only. So we're encouraging everyone who maybe fell behind during that time to get their child immunized. This is an important program because this helps prevent possible outbreaks from our vaccine preventable diseases. And I do have Carrie Delps with me here. She's the division manager over our immunization plan. And we can ask her more questions later if you have them. Maternal and child health, this is my normal division of family health. So this year we requested $398,656. The programs that this funds includes our First Step program. This is our master's level social work program that provides targeted case management wraparound services for our pregnant women and families with young children in the home that are at risk. We also provide our baby basics classes through this program. This is our group prenatal classes that typically we meet in a classroom setting, but we have also moved those to virtual during COVID. So women and their support people are able to join these classes from the comfort of their home and still participate in them. We have newborn home visits, registered nurses that help provide a transition to home for our at-risk families. And then we also fund our fetal infant mortality review program through this, which looks at our fetal and infant deaths that are eligible for review here in our community to help identify gaps and other causes and then recommend actions that we might take here in our community. Local preparedness. Well, you've been seeing this in action since last March. This is what we've been doing through COVID-19. So this is all the work, the preparation and the planning. This is our ICS structure that we've had in place. So our request this year is $108,185. We anticipate we'll still be doing most of that work this year, moving a little bit more into hopefully the recovery as we move through this year. Our regional preparedness, we serve as the regional coordinator for 8 different counties here in Northeast Kansas. So those counties are Marshall, Nemaha, Brown, Donovan, Jackson, Atchison, Jefferson, and then us. And so the requested amount of $37,487 helps to fund the salary for the staff member that serves as the regional coordinator for this group. So during the normal times and also during COVID, we meet as a region, we provide a lot of mutual aid and support to one another, and that's definitely continued over this past year. Our state formula, this is a dollar amount that's given to the Kansas Department of Health and Environment from the legislature. This is then a formula that's based on both our population and our tax allocation. So again, this is a set amount that we're eligible for, and so this year it's $119,329. This is an area that we haven't seen an increase in. I think we're at year 18 that there hasn't been an increase. There was optimism last year that the state formula was going to increase, and then it didn't. I am happy to report that there is a current bill in the legislature to increase this, so fingers crossed maybe next year we'll see an increase in this. The state really allows us to use these grant dollars for what we best see it used for. So we have funded 2 of our registered nurses in the communicable disease program for the past several years with this dollar amount. Family planning. Carrie Delfs, the division manager with me today, is also over this program. So about 2 years ago is when we decided to bring family planning back to Shawnee County. I didn't bring this slide with me today, but at the time when we had done a survey, we had about 53% of the respondents to that community survey that said they would use the Shawnee County Health Department for family planning services if it was offered. So we worked really hard to get this program up and running. We had hired a mid-level, and then of course last year came and kind of the rest is history. So we ended up having to suspend our program just due to the staff and the need for them to be called into COVID work. And so we are ready to start this program yet again. We've got a lot of the groundwork already underneath us and ready to go with that. So our request this year is for $157,471 to bring a mid-level back on and have staff working to get this program up and running, hopefully by July 1. This last slide here is really just a look for you all to see what we've requested this year versus what we were awarded last year. Some of the amounts you'll see are the exact amount. Again, a lot of those have to do with the allocations that are based on different formulas that we receive. A couple of people, I also have Nancy Mitchell, who is our accountant, who's with us today. So Nancy is the woman behind all of the numbers and the budget crunching. So she meets with all the program managers, listens to what the needs are, and helps us finagle all of the different dollar amounts. And then Edith Gaines, who's not with us today, is the actual administrator for this program. So all of the paperwork actually goes into a program with the state, and she is responsible for uploading it and then overseeing it throughout the year. So with that, I'm happy to answer any questions you might have about the grant application or any of the programs.
Commissioner Rippon, any questions?
There's none?
Commissioner Mays, anything?
No, that's a lot.
Yeah.
That's a lot.
Definitely is. I've only been involved with normally the maternal child health section. So my eyes were wide open this year seeing all the AA programs. And so this is a large amount of the work that the health department does in our normal work.
So we'll submit the application today, and then when will we know from the state as to how much is actually allocated?
So each of these comes back in different amounts. And so those that we know are allocated amounts, those are what we know we're going to receive, but those are more competitive. Sometimes we hear as early as, maybe mid to late May, but sometimes it pushes right up to the start of the grant year in July before we hear back.
Okay,
I will be bringing that back once we receive our award notifications.
very good. Any other questions?
Not from me.
I'll move for approval. Is there a second?
Second?
Motion made by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Thank you very much.
Commissioners.
Our next item.
D, Register of Deeds, number 1. Consider approval of request for payment of various items totaling $112,000 from the Land Records Fund.
Good morning, Commissioners. Excuse me. Just a little bit of background. The Technology Fund in the Register of Deeds office is $2 for approximately, for most of the documents that come into our office per page. And when there are excess funds, those could be transferred to used in other offices, which was done at the end of last year. So I'm bringing these requests before you. We have a committee set up to make sure we're following the statute 28-115 that says they have to be used for equipment or technological services relating to land or property records filed or maintained by the county. And these are actually most of them for 2022, so that way when departments get ready to budget next month, they'll know if they have these available. Most of them are for the GIS department. We do have 2 new items, Adobe Cloud Suite and GIS Professional Consulting Services. The appraiser is here. If you have any questions for him or if you have any questions for me, I'd be happy to answer those.
Any questions for Becky or for Mr. Bowman? All right.
I'll move to approve.
Second.
Motion to approve by Commissioner Mays, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0.
Thank you very much.
Our next item.
Item E, Sheriff's Office, number 1. Acknowledge receipt of correspondence from Sheriff Hill regarding the purchase of a Bosch crash retrieval system, contract C-102-2021, from Crash Data Group to be used for investigative information collection at a cost of $18,180 with funding from the 2021 Law Enforcement Equipment and Technology Fund.
Good morning, Commissioners. Under Sheriff Hubler, Shawnee County Sheriff's Office. The really short version of what this is a tool that our crime scene investigators can utilize to see what was going on with the vehicle after a crash, typically a fatality or a severe injury accident. We are asking to utilize money out of our Law Enforcement Equipment and Technology Fund that we have established. And if you have any more questions, technology questions, Sergeant Coffin could answer, and we've spoke with Ms. Griner regarding this. So,
Any questions for the undersheriff?
Not from me.
Motion?
I'll move to approve.
Second.
Motion to approve by Commissioner Mays.
Or acknowledge receipt, I guess.
Knowledge receipt from Commissioner Mays, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Thank you. Our next item.
Administrative Communications.
This is an opportunity for any department head or member of the public to address the commission on any item.
Morning, Commissioners. Dusty Nichols, Incident Command for COVID-19 response in Shawnee County. I just wanted to give you guys and the community a heads up that we will not be issuing the scorecard this week. We beta tested the community index, which is the newer, updated, probably more specific version of the scorecard, but it'll be called the community index. Beta tested last week, would be beta tested this week, and released next week. We thought this was a good week since we're seeing such positive trends, and we got the health order out A little early. I know that kind of caught some people by surprise last week, but seeing positive trends. So this was a good week to kind of get that blank slate in between and then going forward the following week. So I can answer any questions.
Any questions for Dusty? Would just make a note that we will be taking up as the county commission review of the health order on Thursday, as our resolution expires on Friday. And so we'll be taking up the new health order and reviewing it on Thursday as part of our agenda.
I do want to just add, I wasn't going to do this, but I'm going to anyway. I want to add that Dr. Locke and Craig Barnes, who are the operations section chief, who was doing the scorecard, really took a look at that, a really hard look, along with the rest of the team, the technical advisory team, and all the people that have a hand in that scorecard. And I think they got a really good product coming. So I just want to give a shout out to them.
Very good.
Thank you.
Thank you. Any other administrative communications this morning? All right. Commissioner Mays, anything?
Nothing from me.
Commissioner Rippon, anything?
You know, I caught a couple Washburn University baseball games this weekend. It was good to get out. The weather was great. So I did want to thank the IT department here, Shawnee County, for getting this room ready for today. I know they were here almost all Friday trying to run wires everywhere that you don't see, but they ran a mile of wires around here. But I'd like to thank them for getting everything set up so we can move back here.
Definitely. We do appreciate the IT department and all the hard work they do in getting us up and running. I might just note a couple of things. On Thursday, we will also, as the county commission, be taking up the AFSCME contract, and we will be issuing a decision on Thursday regarding that contract dispute. And then final, as this is spring break week for many schools in the community, you're more likely to see children out in the community during the day. So please be aware, it's nicer weather. I expect more bicycles and scooters and roller skates and hoverboards and anything else that can get people from point A to point B. So just be aware of children in the community. So, next item.
Executive sessions.
There is not a need for an executive session, so we are adjourned.